My name is Sharice Graber, and I am performing my physical assessment, comprehensive head to toe. Here is my patient. Before we actually start in the examination, I like to get a little bit of the health history down so we know kind of what the basis is and what to expect. So first, I would start off asking the patient's name and date of birth. What is your occupation?
I am a farmer.
All right. Any history of smoking?
No.
Any significant caffeine intake?
No.
No coffee, pop?
No.
Okay. Next, we'll go to family history. We'll start with your mom. Does your mom have any diabetes?
No, she does not.
Okay. Any significant cardio history, such as like heart attack?
No.
All right. Respiratory. Any issues with respiratory, such as COPD, shortness of breath?
No.
Okay. History of stroke?
No.
All right. Next to your dad. Any history of diabetes?
No.
Any cardio issues?
Not that I'm aware of.
All right. Respiratory, the same. COPD?
No.
All right. History of stroke?
No.
Anything else significant besides what I mentioned?
No.
Okay. Back to you. Any procedures? Any like surgeries that you've had?
Yes, I've had an amputation of my right index finger.
All right. Routine doctor's appointment. When's the last time you were seen by your family physician?
About 3 months ago.
All right. And what was that visit for?
It was a wellness checkup.
Okay. And injections. Are you up to date on your injections?
Yes.
All right. Did you get your flu shot?
No, I did not.
All right. Next, we'll go with skin. Have you noticed any issues with your skin, like eczema, dry skin?
No.
All right. Temperature, has it been pretty warm or cool or just okay?
No, it's been okay.
All right. And elasticity, is it pretty fragile?
No.
Okay. All right. Head and face. Any visual difficulties?
No.
All right. Any hearing issues?
No.
Ringing of the ear?
No.
Okay. Any nasal issues? Any frequent like nosebleeds or any issues at all with your breathing habits?
No.
Okay. Swallowing. How about swallowing issues?
No.
Whenever you're eating, have you noticed any frequent coughing or you feel like it's not going down the right hole at all?
No.
Okay, good. Next is neck. And whenever you feel your neck, do you feel any lumps or anything?
No.
Okay, any issues turning your head side to side?
No.
All right. Lungs. Have you had a cough here recently?
No, I have not.
All right. Any sputum production?
No.
Okay. Have you noticed a wheeze at time?
No.
Whenever you lie flat in bed, is it difficulty to breathe normally?
No.
Any shortness of breath with any activity at all?
No.
Okay. And history of asthma?
No.
Okay. Next is cardio. Have you ever noticed any sort of like chest pain?
No, I have not.
All right. Any like palpitations where you feel like your heart's like beating out of your chest?
No.
Okay. And any circulation issues? Do your toes tend to feel cold, or you notice they're not quite as pink as anywhere else?
No, not really.
And the same as your fingers. Have you noticed any like
No.
decrease in sensation or tingling?
No.
Okay. Next we'll go to muscular. Range of motion. Is your range of motion pretty good? Is there anything inhibiting you in your day-to-day life? Like, are you able to pick up anything you need or move your arms any direction? Is there anything that, like joint pain or anything that's making that difficult?
No.
All right. Any joint pain at all?
No.
Knees, fingers? Okay. Any muscle pain?
No.
All right. GI, is your bowel movements pretty regular?
Yeah.
About how often?
Usually 2 times a day.
Okay. Any issues with constipation, diarrhea?
No.
Okay. Any bloating you've noticed? In any particular time of day?
No.
All right. Urinary. Any issues with being able to urinate?
No.
All right. What would be the color of your urine, you'd say?
I would say a light shade of yellow. Not on the darker variety, kind of a light color.
Any issues with frequency?
No.
Urgency?
No.
Any burning when you have to go?
No.
All right. And you said no history of diabetes for you at all?
No.
All right. I think next we'll go ahead and start your head to toe, and I may ask some more questions as we go along. So first I'm going to make sure you're orientated. So first, can you tell me what year it is?
2017.
All right, and who's the president?
President Donald J. Trump.
Okay. And can you tell me what state we're in right now?
Indiana.
All right, and you already said we went over your history with that. Can you look at me? I want to have you follow my pen. Okay, and can you stick your tongue out at me so I can look in your mouth? Can you stick it out a little more? Okay. What about moving your head side to side? All right, looks pretty good. That's good. All right, so first, we're gonna go ahead and get your vitals here. We'll check your blood pressure. Can I see your arm, please? Do that wrong way. All right, so while we're checking your blood pressure, I'm gonna go ahead and check your temperature, okay? All right, 97.9. Let me go ahead and feel your pulse. All right, 119 over 65. And pulse of 66. Pretty good. Is that about your normal? Do you know what your average blood pressure is?
That's about normal.
Okay, good. All right, and are you currently in any pain on a scale of 0 to 10, 10 being the worst pain you've ever had, and 0 no pain? What would you rate your pain right now?
0.
Okay, good. All right, so now we're gonna go back to skin. Your skin feels pretty warm. Check your skin turgor, pretty elastic. No issues with texture or anything. I'm gonna go ahead and look at your fingernails. Make sure we have good circulation there, and that's good. Texture is pretty good. You said no conditions. You said no visual difficulties, and you followed my pen very well. Neck. I'm gonna go ahead and feel your neck. I don't feel anything issues. And can you move your head side to side for me again? Pretty good. Now I'm gonna go ahead and listen to your lungs. You said no cough, no shortness of breath, no history of asthma, correct? No. All right. All right, can you take a deep breath in and out for me? All right, one more. All right, I lied, 2 more. Let me listen to your back here. Deep breath in and out. Okay, one more time. All right, pretty clear. All right, now cardio. You said no chest pain, no history of that.
No.
I want to go ahead and take a listen to your heart. All right, I don't hear any abnormalities. So moving on. Upper extremity, you said no joint pain. Can you move your arms out pretty good to your side? No issues at all. All right. And abdomen. I'm going to check for symmetry. It looks pretty symmetrical. Listen to bowel sounds. All right, pretty active. Listen at all four quadrants there. And you said no issues with that. No, your bowel movements are pretty regular, no bloating, constipation, and urinary issues were pretty good. Lower extremities, have you noticed any varicose veins?
No.
Any coolness to touch or anything?
No.
All right. Have you noticed any swelling?
No.
Okay. If you want to stand up for me and put your foot on the chair. I'll take a look. Feel your pulses here. All right, feels good. No swelling noted.
No.
All right, so now while you're sitting up, can I have you squeeze my hands for me? Squeeze my whole, okay, now squeeze. All right, pretty regular strength, no weakness noted on any side. Can you push your hands against my hands? Push it down. You don't want me to push your hands up, so push down. All right, and now I'm gonna do the same to your feet. Push your feet down against my hand. All right, and this one? Okay. Pretty symmetrical, no weakness noted on either side. Now can I have you, if you have any issues being able to bend over or anything, no range of motion issues?
No.
All right. I think we have completed our head to toe. Everything looks pretty good. Do you have any questions or concerns for me?
Nope.
All right, thank you.